Pheresis is the Greek word for separation. Medically speaking, pheresis is the procedure of collecting stem cells from the blood, but that's the second step in the process. The first step is to move the stem cells from the bone marrow where they live into the blood. We do this with a process called mobilization. We can move or mobilize the donor's stem cells by giving them growth factors. Growth factors are proteins that stimulate the production of large amounts of stem cells, causing them to overflow into the bloodstream. The growth factors are often shots given under the skin. The growth factors are started prior to pheresis. There are several different growth factors and schedules that can be used. Look at the mobilization section of the strength binder for specific information about the growth factors. Side effects of these growth factors include bone pain, fevers, lack of sleep, nausea, and pain where the shot was given. We prefer to collect the stem cells from the veins in the arms, but if the veins are very small, we may have to put a special central venous catheter made especially for this procedure into the donor's chest. If a central venous catheter is needed, a doctor will insert it in a radiology procedure room. The procedure is usually done on an outpatient basis by an interventional radiologist. The catheter is usually placed in the morning. The donor should not eat or drink anything after midnight the evening before. Prior to the placement of this new catheter, the donor may be given medication through an IV to make them sleepy. So remember, the donor will need to have a ride home that day. They will also be given a local anesthesia to numb the area where the catheter will be placed. On the day of pheresis, special tubing will be threaded through a machine. The tubing is then hooked up to the veins and arms, or if necessary, the central venous catheter through two lines. One line is used to pull blood out of the body, and the other line is used to return it. While the blood filters through the machine, it mixes with an anticoagulant to keep it from clotting. The machine then separates the blood, collects the stem cells, and returns the remainder of the blood to the donor. The average procedure takes anywhere from 4 to 6 hours, depending on the donor's height, weight, blood counts, and procedure tolerance. A larger person typically takes less time than a smaller person. On the collection day, the donor should be sure to eat a meal before the procedure, but limit the intake of liquids and caffeine to decrease the need to use the restroom. If the donor needs to go to the bathroom, the nurse will pull a curtain around the donor to give them privacy. Men will have to use a urinal and women a bedside commode. The donor should wear comfortable clothing, and it's helpful if they wear a shirt with short sleeves so it's easy to get to the arms. If the donor has a central venous catheter, it's helpful if they wear a shirt that buttons up the front. If the donor is hungry during the procedure, they may eat a snack. Snacks or a lunch tray may be ordered, or they can bring their own food. They may nap, watch TV, read, or work on paperwork or a hobby during the process. Only one guest is allowed in the pheresis unit due to limited space. Bring any medications and take them as usual. Common side effects of pheresis include being cold, tingling and numbness around your mouth, vibrating feeling all over your body, twitching of your arms, leg cramps, lightheadedness, dizziness, and nausea. The tingling, vibrating, and twitching are related to the anticoagulant binding to the calcium in your blood. It's important to eat calcium-rich foods before your collection. If these symptoms occur during the procedure, we'll give you Tums or an infusion of calcium. Let us know if you have any problems so we can help make them better.
During the pheresis, I didn't have too much in the way of side effects. I had some tingling in my appendages, but really it was not bad at all. The stem cell harvest, in my case, I was able to do it in 4 or 5 hours. Some people it takes a couple of visits to get the number of stem cells that they need. In my case, it seemed to go pretty quickly.
There's a predetermined number of stem cells that the doctor wants collected, which is based on the patient's disease and other factors. Each day after the collection, the stem cells are taken to the lab to be counted. Within a few hours of collection, we'll know how many cells were collected. If we have enough, someone will call the donor to tell him not to come back the next day. If the donor doesn't get a call, they will have to come back for more collection the next day. One collection may be enough, or it could take up to 2 days or more. After the lab counts the cells, they are taken to another lab to prepare them to be infused into the patient. In most cases, the stem cells are given to the patient the same day of the collection. In rare cases, the stem cells will be taken early and frozen. If the stem cells are frozen, a preservative called DMSO must be added to the stem cells as well as some plasma. This prevents the stem cells from dying during the freezing process. After the preservative has been added, the cells are slowly frozen to a very cold temperature. The cells then can be left in this freezer for at least 10 years if needed. Being a donor can be a very rewarding experience and is surely a life-saving measure for the patient. The donation process can cause strong feelings, especially if the transplant does not succeed. These feelings range from stress during the process to great joy or feeling sad after the donation. By donating for a patient, you are doing all you can to help them. You cannot control the success of the transplant or whether the patient lives or dies. Donors should not feel personally responsible for the outcome. We encourage the donor to discuss any concerns they may have with the transplant team.